Good afternoon. I'd like to welcome everybody to our community updates for Friday, April 24th. Introduce myself real quick. I'm Mark Johnson, spokesperson for the Beadle County COVID-19 Unified Task Force. Before moving into our topics for discussion, I'd like to start with a brief update from the task force this afternoon. The current update from the South Dakota Department of Health shows 21 positive COVID-19 cases in Beadle County and 2,040 cases statewide. Beadle County now has 19 individuals who have recovered from COVID-19. I'm going to keep my information pretty short as we have a lot of good information prepared for this afternoon. We're going to talk with Dr. Josh Carr shortly about how Beadle County residents are still being tested for COVID-19. The Beadle County COVID-19 Task Force is still encouraging good social distancing techniques as there's still a threat present out there. We encourage the community to continue and support our local businesses, along with making those vital donations that keep our local organizations operational. I do have a statement I want to read about the rental assistance that is available. They have received 36 total applications for the rental assistance. 2 of the applicants did not qualify as they are for mortgages. They have had 14 employer verifications returned, plus 1 confirmed self-employed verification, so there's a total of 15 altogether. Of the 14 employer verifications, 4 have been denied assistance and 2 were invalid. The employers are very honest and sincere with their responses. The biggest thing that they're having is they are encouraging employers to make sure they're checking their spam or junk email to follow up so they can get that assistance out to those individuals. The Community Development Foundation has received 3 additional donations for the rental assistance totaling $2,200, and that additional funding is available. And they have sent thank you notes out to that. And the Huron Housing Authority is the ones that are actually issuing those checks to the landlords, and they will be going out next week. We do get asked this question frequently that we wanted to address in regards to a timeline or what the city and county are doing as far as maybe loosening some of the ordinances and so forth. The Beadle County COVID-19 Task Force is working with the elected leaders to implement an action plan to amend current ordinances and resolutions. They don't necessarily have an exact timeline or a timetable due to making sure that they are following the current direction from the CDC, the president, and the governor. Hopefully in the upcoming weeks, you can start to see some of the changes. However, we need to still maintain current guidance so we don't have a spike in COVID-19 cases. So, as I said, I'm going to keep my portion brief, and we're going to start off by talking with Dr. Josh Carr from the testing facility and call center.
Awesome.
How are you doing today?
Good. So, like Mark said, I'm Dr. Josh Carr with the Beadle County COVID Collection Site and Call Center.
Okay. Can you give us an overview, Dr. Carr, as far as what somebody can call out to the call center for?
Yeah, so currently right now, we are taking calls for individuals that are experiencing possible symptoms related to COVID. We are also taking calls from physicians that would like their patients tested. And then we are also taking calls from individuals that just may need some information, from the community as far as where to get some help, and we can direct them with that. I'd like to bring up again the 211 number, which has been very integral as of late in helping individuals get assistance that they need.
Okay. Now, I know that this came up along the lines, are they able to call out to the testing facility and you guys are able to issue a doctor's note or a doctor's order? Maybe they have a fever and their employer's telling them that they need a note of some sort.
Yeah, so we've had a couple different issues with that. We do have myself, my uncles, Dr. Wayne and Dr. Joe, on staff kind of manning the call center, but typically we want that note to come from the provider that they are being treated with. So we don't have that necessary scope or ability to do that, so they would need to call back to their provider and get that. Plus, we still want to make sure that if they do have, let's say, flu-like symptoms, if they do test negative or if they're under quarantine, that they're still following those guidelines, as far as the fever, 72 hours, medication-free, so on and so forth. So that needs to come from their treating provider.
Okay. Can you kind of refresh everybody that's watching the steps that somebody has to go through to be tested at the testing facility?
Yes. So first off, let's say the patient or individual just calls into the test center and goes through their symptoms, and we feel that they may have COVID. We would direct them to then contact their provider to discuss those symptoms with them. And then that provider would either call the call center or fax us an order. So we would have that to get that to the lab. From there, we would go through our process of priority testing with, hasn't changed, with the hospitalized, the healthcare workers, the first responders, and long-term care facility. So that's still our priority level of testing. And if they fall under that, then they would get tested. Otherwise, we continue to monitor their symptoms through our call center and continue to track them along if they do need to be tested later on if their symptoms worsen.
Okay. And this comes up on a pretty regular basis. Are you still testing on a daily basis?
Yes, we've, for the most part, been testing daily. Our current test numbers, on average, we're about 2 to 3 per day. We have not been testing on the weekends as of late, so our testing has pretty much been Monday through Friday at this time now. But we still are available to test on the weekends for those high priority patients, primarily healthcare workers, first responders, all that. So, but about 2 to 3 per day during the weekdays.
I know initially Beetle County is labeled with community spread. Is that still a concern?
Yes, I think as you stated earlier, our elected officials are still have the ordinances and restrictions in place. And we were on a call with the Department of Health the other day, and Jake will be able to probably touch on this a little bit as well. With our community spread, is the potential is always there, especially in a state such as ours when Sioux Falls is not that far away. So I think even looking at the bigger community of South Dakota in general, there is that sense of community spread. So we can't just look at Huron and Beetle County, but the close-knit of Sioux Falls.
Okay. I know we're going to talk with the officials from HRMC here shortly. Does the new Abbott COVID-19 rapid testing machine play a new role for testing in Beetle County?
It does a little bit. We've worked closely with the hospital, fortunately, and they've given us access to some of their swabs, because what we want to do is those, primarily those healthcare workers, we need to know quickly. And we've been able to get those results very quickly to determine if there is any type of spread. So yes, it's played a big role in our ability to get those test results back for those high priority testing.
Anything else to add?
No, I don't have anything. I think as far as our call center and collection site, we've worked really hard to make it a streamlined process, and with the help of everybody, our call center volunteers, the HRMC lab has helped us out a ton, and all our collection, people that are working, we've done a really good job. I appreciate all their help.
Okay. All right, thank you. We're now gonna switch over to Dr. Jake Redden from HRMC. He's got some updates as far as how Beetle County is doing flattening the curve and some issues that we still need to be aware of.
Thanks, Mark. So I am Dr. Jake Redden. I'm with the HRMC team, and I'm also one of the technical specialists on the Unified Task Force. Just a couple of the basics as we kick off here. COVID-19 is a respiratory disease. So as we talk about social distancing and some of the elements that we want to make sure are employed to that, it's all focused around protecting and prevention of the respiratory disease. The coronavirus is spread through airborne and contact, and there is no current treatment or vaccine. So we do want to take this as serious as possible. We do know that 80% of those infected will have mild symptoms. kind of a rough flu to just a light cough for the duration of those 14 days of your average symptomatic time. However, we do see that 5% will need hospitalization. This is actually a decrease from early on when we were looking at global statistics that we saw a 14% hospitalization rate, but across the US over the last 60 days, we're only seeing a 5% hospitalization rate, which is a good sign. Symptomatic, most folks will show symptoms within 3 days of exposure. They'll have shortness of breath at 5 days of exposure, and those that end up in an ICU will happen within 10 days, but it can happen very, very quickly, so it is a very, very serious incident. The high-risk categories in order are by age, and after age is our overweight population, followed by high blood pressure and other respiratory illnesses, such as COPD or sleep apnea are also high-risk categories. Anyone who's immunocompromised, or of course anyone with other comorbidities that would fall into those previously identified categories. Your best defense to protect yourself from the coronavirus is to stay home. There is no better practice than staying home and staying safe and being away from those high population density areas that it could bring some exposure to you as an individual. If you can't maintain that stay-at-home position, then maintaining greater than 6 foot social distancing when you are out in public or out experiencing some of the economic businesses that we have available. That's followed by hand hygiene. There's a lot of exposure and a lot of spores that will get on those hands, and being able to wash those hands will help protect your respiratory system from having any exposure from that direction. Finally is masking in public. When you utilize any woven material or homemade mask, that's going to provide a 30% protection. So I want to make sure that people don't realize that masking by itself will be a silver bullet by itself. Your best defense, again, is to stay home. If you are sick or you do have symptoms and you haven't been tested, the South Dakota Department of Health has put out guidance for when you can return to work, school, or activities. That includes not having a fever without the use of any fever-reducing medications for at least 72 hours, a full 3 days since your fever has been out there. And you have had improvement in any respiratory symptoms such as a cough, shortness of breath, all that's been resolved. And it's been at least 7 days since any of those symptoms initially were onset. The Governor Noem has put out what our expectations are. We are expecting our peak to occur in June. Like Dr. Carr said, there is still community spread that's occurring out there across the entire state, and we're expecting that number to be in June. Early projections in early March did have an April expectation, but the people of Beadle County and the people across South Dakota have done a fantastic job with that self-discipline and self-isolation, and that's caused our target to move to the right. We are still expecting between 250,000 and 600,000 infected people across our state, and again, 5% of those will likely need a hospital bed. Again, everyone's been doing a great job, but even after we experience our peak, we will expect this kind of community spread and the protections we have in place now to continue on until August. And the reason I want to point that out is we have our different projections, and this comes from the Sioux Falls team. Because we don't have any community spread in our county, we can't run these same kind of projections for when our peak time will be for Beadle County, which is a good thing, but it's a very similar outcome. With no social distancing, we will absolutely outpace our medical capacity in a short amount of time, and that'll bring in your likely peak date. With 25% reduced contact, Sioux Falls, they're expecting a May 15th peak time. If they get 35% social distancing factor achieved, that'll push it to May 28th, and then the South Dakota peak will follow that on. But that doesn't mean that our only infected people that we'll be treating in the hospitals occur on those dates. As you can see, if we have our May 28th peak date with our 35%, Sioux Falls, they would expect to have just over 300 people inside their hospital. That means the day before, they're going to have 299, and the day after May 28th, they would have 299. And so we will continue to have people in our community with community spread well into August. And that's the factor we're looking at. So what does that mean from a hospital impact? And these are the numbers that were ran for Minnehaha and Lincoln County. With 25% social distancing, and when they hit their peak on May 19th, they'll have approximately 720 inpatients inside their hospital. This yellow line here will result in approximately, out of those numbers, 150 will be in an ICU bed or an intensive care unit. Underneath that, on May 16th is when they expect to maximize their ventilated patients. Approximately 50% of all ICU patients will end up on a ventilator. And the ventilator is one of the scarce resources in South Dakota. And so the goal of moving from a 25% social distancing factor to a 35% social distancing factor almost cuts our hospitalizations down by half. We also see our ICU and our ventilator needs. So that's the gold standard that we're looking for across the state, is to achieve that. And like we've said in Beadle County, we've done a tremendous job up till now. So what does 35% social distancing look like? Earlier we did school closings. That creates a 4% reduction in social contact, which will result in 15% less intensive care unit beds available for our community, which is a great thing. Having those groups less than 10 available in our community will grow to 15% social distancing construct and a 42% reduction in ICU beds needed. And then finally, doing both of those and all non-essential people staying home and only going out for necessary trips will achieve that 31% goal with 65% less ICU beds needed in our community. We have a couple of different measures out there that are validated in different resources to help give us an indicator of how well we're doing with our social distancing criteria. Again, this is what Sioux Falls is looking at. They shared this previous Friday with their team. Those two social distancing indicators is this yellow and pink line across here. They both kind of validate each other, so it's a real good indicator. These valleys right here are the weekends. Our best time that we're doing our best job at social distancing is occurring on the weekends, when we don't have a lot of e-commerce that's happening, people aren't going out to restaurants, kids aren't going on trips, so people are staying home and enjoying their downtime, which is exactly what we're looking for. These peaks right here are the work days. So this is still an indicator that a lot of non-essential people are still going to work, they're still migrating during the weekday, and they're still looking at what they're able to get out and do. So far, Sioux Falls has been able to achieve a 25% social distancing factor between March 22nd and April 4th. And the down check is the previous week, they only achieved an 8% social distancing factor. And as you can see, their positive count continues to go up because they haven't been able to achieve that 30% goal. We've ran the same numbers. While we're not able to determine our hospital peak times, we can measure our social distancing factors here in Beadle County. We have the same peaks and valleys of the workday and then the weekends, but you'll see that our curve went down tremendously. In fact, we've been able to achieve a greater than 50% social distancing factor, which has been a huge win for our community, and it's been the secret reason, the super reason, that we've been able to have zero spread in our community for greater than 3 weeks now. But it's been a while. We have been in this posture. People are starting to get comfortable, and we're starting to reduce off of our self-compliance with that social distancing. So what does that mean? This is a cleaned up version of that same data. And this green line is our data that also has a projection out if we continue on the trend that we are. This green line, your red, is your zero social distancing factor, and that's when we will absolutely have a high impact of community spread that occurs. But this yellow line is our 0 to 30% goal that we're looking for. This big square right here was our previous community spread period, and you can see with your 3-day symptomatic show that was right inside that less than 30% social distancing factor. Here's where our current data takes us to, and we'll be back likely in that high-risk zone if our community continues to drift upwards instead of maintaining our current social distancing factor. We'll be back in our high potential for community spread, and that is absolutely what we want to avoid. We want to maintain greater than 30% in order not to exceed our hospital capacity and to have that less burden on those ICU beds that we're looking for. In our community, Huron, we have about 17,000. According to the 2017 population estimates, our greater Huron and Beadle County population hovers around 30,000 population. If we get 80%, which is the WHO early expectation, we'll see 24,000 infected people. If we go with a 30%, which is our local United States expectation, 9,000 people of our community will end up being infected. That'll have actually between 90 and 240 fatalities, and this is adjusted up based on core morbidity factors in our community. But with that 5% hospitalization, we'll expect to see between 450 and 1,200 people in our hospital. So what does that mean? Again, we want to reiterate, if we can achieve 31% social distancing, something we've already done successfully to date, and that's what we get to put our big wins on, that'll result in 65% less ICU beds, which is absolutely what we want to achieve. When these folks start coming through and we start to see our positive cases creep into our community, we absolutely want to be able to give them the very best health care that we can give them at HRMC. And that's why our plea to you is to absolutely stay home. I know it's been a while since we've had a community incident. I know it feels safe. I know that we're seeing a lot of commentary on TV, but please, from the task force, from your hospital, from your community members, please continue to stay home. Please continue to take this serious, because that is absolutely what's going to keep our population safe. Thank you.
Thank you, Dr. Redden. We're going to stay with HRMC staff here. Give me 1 second. That may need some. The presenter's having technical difficulties. There we go. All right, apologize for that. We're gonna start by talking with HRMC's lab director about some new equipment that they have received.
So I'm Erin Scarborough. I'm the lab director at HRMC. Last week we did receive the Abbott ID Now. The Abbott ID Now is a molecular point of care analyzer given emergency use authorization by the FDA for rapid screening of the COVID-19 virus. The analytical processing time is approximately 13 minutes. HRMC still uses the criteria from the state's public health lab, and this is due to limiting supplies and reagents for the analyzer. We also utilize the rapid screening in correlation with clinical significance to help assist providers in determining transfers and admissions to the hospital.
Thank you. Is there any other advantages of having that rapid tester in-house?
I just think it gives us the ability to have a more concise test in a shorter amount of time.
Okay. And now HRMC's made some changes on the inside and outside. We're going to talk to other staff members here. We're going to start with Director of Emergency Services, kind of walk us through some of the stuff if somebody comes into the ER, what they may see.
Thank you, Mark. My name is Stephanie Metzger. I'm the director of the Emergency Room and Outpatient Department at HRMC. There's been a lot of questions about the buildings out in the parking lot, so I'd like to walk you through some of that today. This first picture you're seeing is at the north entrance of HRMC. In the event of a surge, we would have a parking attendant here at this building. We're asking everyone in the community to use this entrance. You'll notice there's a barricade up on the south entrance. When you arrive, the parking attendant will ask where in the building you're going. The purpose of that is because we've dedicated entrances throughout the building for what you are there for. If you are coming to the emergency room, we would have you advance forward where you would be met by a triage nurse. That triage nurse would go through your symptoms. From there, decide, do you need to be in a COVID suspected area, or can you enter through the normal ER entrance? In the next slide, you'll see a picture of our treatment shed. We'll be utilizing this for the non-critical COVID suspected patients. There'll be a nurse and a provider staffed in this building. There may be a wait to get in this building. In that case, you would be asked to wait in your car where you would be able to communicate with the nurses by phone. In the next slide, this is our regular ER entrance. We are not in a surge right now. This is what we are utilizing. There is a nurse in the window that you can see here that will ask you a series of questions and take your temperature. From there, you will either proceed through the normal ER door, or we will take you through a new entrance in the next picture here. This is just south of the ambulance bay. We have built a ramp so that we can accommodate wheelchairs and ambulance patients. If we suspect that you have any COVID-related symptoms, this is the entrance we are bringing you in right now. And again, in the event of a surge, this is the entrance we would be using for the critical patients. On the next picture here, just inside, you can see that we put up a temporary wall to make a private hallway into the back of the emergency room. This again is just safety measures that we've put in place to keep everybody safe. On the next slide there, this is some more temporary walls. The ER is divided in half right now, again into COVID and non-COVID suspected symptoms. We have made it safe for everybody and for our staff. We are encouraging you to still utilize the ER when you need to. If you do have COVID symptoms, we ask that you call ahead. We are putting on a lot of personal protective equipment to take care of you. And we'll show some pictures here today of what that looks like when the nurses are in all of their gear.
Okay.
Yeah, there is a picture there of PAPR. And that is what we're using on the COVID suspected side.
Okay. Are there visitor restrictions in the emergency department?
Yes, we are not allowing visitors right now. Again, that is based on guidelines from the CDC. We're following those closely. In the event of a very emergent situation, we may allow one visitor in, but that will be determined on a case-by-case basis. But at this time, there is no visitors, and that is, again, for the safety of the community.
Okay. All right. Thank you. Next, we'll talk with Director of Inpatient Services.
Hi, my name is Amy Gergen. I'm the Director of Inpatient Services. And as Stephanie just got finished with the ER department, once a patient is determined that they need to be admitted to our facility, whether they are COVID or non-COVID patients, we do have a little bit of plans and in process right now. If you want to go to the next slide. This is just right at the beginning when you come up to our units. There is a place for all of our nurses to prepare to get ready to take care of these COVID patients. They don and doff, meaning they get all of their equipment on. They have a clean area. They have an assistant. We have orientated numerous staff to help with that, make sure that it's on properly and correctly. So these frontline staff are designated nurses and other team members, and they'll prepare to enter to care for these COVID positive patients in these areas. You can go to the next slide. Again, this is just what kind of equipment we have, the suits that we utilize. The next slide shows a couple of us all in our gear. As you can see, there's a PAPR, which is the powered air purifying respirator. We also have fully gowned gloves, and we're all ready for those. Typically, we are aware that these patients are coming up to the floors, so as Stephanie said, we can prepare and everybody be safe. Go ahead with the next slide. Again, once the nurse is completed in those rooms, or they're taking a break, or they're done for their shift, there is actually an area where they can doff all that equipment, which means take that off in a proper manner as well to keep everybody safe and to keep them non-contaminated. Go ahead. So this is the looking at the end of our hallway on our med-surg department. With a patient being admitted from the ER department, they do come up one of our back elevators that is designated. They come up all the way through this hallway, which is our COVID area. So each of these rooms, there is 10 rooms, truly 5 rooms, but we can double up into 10 rooms with the med-surg. If you keep on going, then we continue on into our ICU. Again, this is all one ward. It's all connected together so the nurses can help each other and flow back and forth to the different areas to assist each other. They also have assistants with them. We have radios, things like that. So if they do need supplies that are out of the COVID ward unit, those nurses aren't going back and forth to our non-COVID areas into the COVID areas. They stay in that department. So that is a look into our ICU. We do have right now currently, as again, like Steph said, we're not in a surge. We have 4 rooms prepared. All the rooms have all of our supplies in them and are set to go for any patient at any given time. So I believe the next slide will show a, single room. That is one of our single rooms in ICU. We have the monitors, we have the ventilators close by. We have 4 of these rooms right now that have we have enough ventilators to care for these critical patients if needed as well. And with the increase in a surge or COVID positive patients needing hospital care, our whole team has worked together to prepare more rooms, because we do have a total of 8 rooms that we could put actual ICU patients in. So right now we have the 4, and then with 2 rooms being available for still our critical ICU patients, because we do still function on a day-to-day, and we still have our everyday cardiac patients and different patients that we need to take care of safely and in our non-COVID departments. So we have different levels that we would surge and then add those rooms as we go. Let's look at the next. Again, this would be the clean side of our ICU, the clean or non-infectious side of the ICU. Those are walls, again, temporary walls that we have, and we can maintain care and the 1 designated or 2 designated nursing staff that are not then in the COVID area. Next. If I mentioned, we do have negative pressure rooms. We are fortunate in our facility that we can and do have 14 right now negative pressure rooms. This is the system that provides that negative pressure room. And what I mean by a negative pressure room, that's an isolation technique used in hospitals to prevent the cross-contamination from room to room. So this designates like a negative pressure to allow the air to flow into these isolation rooms without the airborne contaminants coming back out of those rooms. This is not in a patient room, but that's what the system looks like, and that's how we would utilize it. Again, this is not a requirement by CDC to have those negative pressure rooms, only if it's available and we have the resources to utilize them, which we do. If we needed to surge even farther than those 14 rooms that I've already talked about, this would be the hallway. This is actually our current med-surg department, non-COVID department that we take care of all of our patients, which is again completely separated from our COVID department. I just want to emphasize that we keep our staff safe, we keep patients safe currently now, even with positive or suspected COVID patients. Moving on, so this would be up in our OB department. A lot of questions out there on how are we going to prepare, or how have we prepared for our expecting parents. Again, we have 2 rooms, negative pressure rooms, up in our OB department. These then are, again, separation from our non-infectious families. So, the nurses are in there, they have a area where they put all their personal protective equipment on. They use the same thing that I showed before, and then there's an area for them to remove all that safely as well. We have worked together really well with other facilities, other departments. If you remember, we were the first hotspot in South Dakota. So we kind of worked with other facilities. We've actually shared a lot of our information with other facilities, as well as other facilities sharing information with us, because we did come up with some ideas and plans and things because we needed to a lot quicker than some of the other areas in South Dakota. So we're all in this together. Not one of us at all knows everything about it. Everybody has to work together, as well as we've been working with the community. And I keep on calling it living with COVID time. So just keep safe. Everybody needs to stay home, and kind of what Dr. Redden talked about as well earlier. And then we also have some processes in place, which I know have been touched on a little bit, but I'm going to turn it over to Pam on what it looks like walking into HRMC.
Okay. We'll
Thanks
turn it
for
over to
having-
Director of Surgery and Infection Control.
Thanks for having us today, Mark. My name is
Oh.
Pam Schultz, infection prevention at the hospital. Much of what I do has already been hit on by some of the other team members, but just to reiterate a little bit, as part of our process to protect both patients and employees, HRMC has screeners at all of the designated doors. Everyone coming in answers screening questions and has their temperature taken. Patients or visitors are masked at that point, and all these things are done to just help lower that possible exposure risk. We do use recommendations in compliance with Department of Health and the CDC. And I'll just go on with that a little bit about the visitors. So as Stephanie alluded to already, those visitors are very limited, and it's for those same reasons, for avoiding exposure. And they too are, like I say, given a mask to wear during the visit. On that same note, HRMC is humbled by the generosity, talent, and outpouring of support in terms of cloth masks from seamstresses in the Huron and surrounding communities. To date, over 2,500 cloth masks have been sewn and donated to the facility. So we do remain grateful for all of the understanding, cooperation from all of our patients and families.
The ear savers that TrustBuilt was making, how have those been used or issued out to the HRMC staff?
So they are readily available at the hospital, and many people are using them. It depends on what department and what design of cap and mask you try to wear, but we too are very grateful for all those things that our community members have stepped up with. Makes a big difference.
And currently, I know that we have no active cases in Beetle County, but HRMC has done a lot of planning. You have a huge surge plan that you walk through, and it's key with all the information that Dr. Redden also brought up, that we still follow those social guidelines. So, HRMC doesn't have to go in and actually use all that equipment that they have set up. So we want to make sure that, Beetle County and HRMC has been preparing and planning. We don't have any active cases right now, but like Dr. Redden said, that this is stuff that we do need to take seriously and keep in the back of our mind. And hopefully we don't have to have somebody go into some of those units. So I thank our HRMC guests and Dr. Carr for coming in. Any last thoughts from anybody that's here? No? Okay, we are going to take a brief pause. We do have to switch over to a different audio source. So if you bear with us, hopefully we'll be back online in a minute so we can get our Zoom participants in our chat. Okay, we are gonna get started. We have David McGurr and Lori Shelton joining us over Zoom. We're gonna start with David. He's gonna share the results that Greater Huron and the Chamber, the results of their survey that they completed. David?
Thank you, Mark. The Development Corporation and the Huron Chamber and Visitors Bureau did a survey over a week time. We had a really good participation from the community. We had 1,251 people take the survey. This was a joint project, like I said, of Greater Huron and the Chamber. And if you want to see the full survey results, you can go to greaterhuron.com and you can see all the charts and graphs and raw data from that survey. But we're going to give you a quick overview of what we found right here. 24% of the participants were male, 76% were female. There was a lot of personal impacts. 32% of those surveyed were unsure if their job was secure or they had already been impacted on their job. 70% had struggled with some level of loneliness, anxiety, or depression. The majority of those were a small level, but some of them were seeing moderate or a lot of those symptoms. 63% experienced some level of financial impact already. and 6% are not certain if they can pay their May rent or mortgage. So the personal impacts have been really huge from this crisis. Community's response, 97% of the respondents personally took the safety recommendations seriously. 78% of the respondents felt the rest of the community is taking the crisis seriously. And 52% were unsure if Huron is prepared to handle what is still to come. Shopping patterns that we observed in the survey, 55% are visiting a restaurant at least once a week. However, that's down compared to 84% who did that prior to the crisis. 34% have brought groceries online from a Huron retailer. And, prior to the crisis, we would estimate that was probably 5%. So that's really impacted the way that grocery stores are doing deliveries. And in fact, the manager at Coburn's told me they did over 2,000 online orders last week. 53% have increased their online purchases from out-of-town outlets to some degree. And, if you can't get something in town, we understand that. But our retailers are really suffering through this, and we want to see them on the other side and see the fabric of our community maintained. Please buy whatever you can locally in town. On the lighter side, 8% didn't have enough toilet paper on hand for what they wanted to have. 24% had more than 16 rolls, and 2%, which was, I think, 26 of the participants, said they had more than 60 rolls of toilet paper on hand. And the manager of Coburn's told me they sold 96 pallets of toilet paper in 1 week. So he thinks there's a lot of toilet paper stashed away out there in our community. And 50% reported they're on track to gain the COVID-19 or more pounds due to boredom or stress eating. And last but not least, 68% visited or plan to visit Huron to Go on Facebook. And that's a new group that is the Chamber and the Development Corporation are co-sponsoring, where restaurants and other businesses are posting daily specials on there. And there's a lot of great deals on there. The restaurants are posting pictures of the food they have that day, et cetera. So if you have time, just search Huron to Go on Facebook. So from the survey needs that were identified, we want to point out that there is some available assistance for you. If you're in need of unemployment benefits, rental assistance, if you're unable to pay your rent, or if you are running a business and need a loan or a grant to make it through this crisis, information to all of those resources is on greaterhuron.com, and just click on the COVID-19 tab at the top of the page. If you have questions about COVID symptoms, or you want to request testing for COVID, call the Huron Call Center hotline. And that's 353-6214. And that's 353-6214. Resources additionally for anxiety, depression, and loneliness are available at community counseling at 352-8596. Food assistance information is being gathered by Lori and her staff at the Chamber. She will be making a report on that here when I'm done, and they will also have that on their website after this seminar is put out. And again, I would mention the Huron to Go daily specials. And if there's anything you wanted to know that you didn't find on these resources, or if you forget the address or phone number to any of these, simply dial 211. That's a resource center that has all of these phone numbers, all of these links. So if you need any information about COVID, rental assistance, any of these items, dial 211. Thank you for your time. And on behalf of the Chamber and Development Corporation, I want to thank the 1,251 participants in the survey. Again, if you want to look at the charts and graphs and data on the survey, go to greaterhuron.com. Thank you.
Thank you, David. We're going to switch gears and talk with Lori Shelton. She's going to talk about some resources for food and essential needs and ways that you can also donate back to your community. Lori?
Yes, thanks, Mark. Again, I'm Lori Shelton with the Huron Chamber and Visitors Bureau, and I want to start off and thank you, Mark, for what you're doing as far as putting this information out. And a big thank you to the HRMC staff and the leaders and the Beetle County COVID team as well for helping to keep us safe and informed. So it is very much appreciated, and it maybe helps to put some fears behind us as we hear that information. So thank you for that. What I wanted to share with you, because during this COVID time, we know that there may be more need for food resources for families out there, essential items, and wanting to make sure people know where they can go to get that help, because maybe you've never needed these resources before. So just know that there are resources out there, and if you're not in need of those resources, again, we're going to give some information of how you can help, because in my conversations with all of these entities, they are doubling the amount of meals that they have provided in the past before this COVID pandemic. So their needs are really great. So any donations, if you're getting your stimulus checks, or if you have room to donate food, non-perishable items, or monetarily, they all need it. So first of all, the Huron Salvation Army, they're located at 237 Illinois Avenue Southwest. They serve hot lunches available Monday through Friday from 11:30 to 12:30. Now, it used to be they served them in their lunchroom, but currently they're doing a drive-through pickup service. So you'll enter in and follow the signage there, but you can pick up bag hot lunches or hot lunches every day. They do bag lunches Saturday through Sunday, and there's no qualifications for that. You can go drive through and get your meals there. They do have a food pantry that also has food and essential items like toothpaste, dish soap, that type of thing. You are able to get one box to qualified residents every month, or recipients, every month. They do have some qualifications, and you would want to call the Salvation Army for that to make sure that you fit within that. But if that's a need, don't hesitate to call. They're going to tell you if they can help you or not. And again, in talking with the Salvation Army, they are doubling what they normally do on a weekly basis. So making monetary donations to them, it would be a great resource. So you can do that either by mailing a check to them. You can also do a donation via credit or debit card. You do go to the www.salvationarmy.org website. You choose the Huron, South Dakota location, and you can donate directly to Huron to help make a difference. You can purchase gift cards. You can drop them off at the Salvation Army from any of the local grocery stores, or you can also tell at the grocery store, if you're going to Fair City or Coburn's, both of them have accounts that you can say, can you just give this to the Salvation Army? And they have accounts for them. So that works as well. And then those entities let them know what they have. But they are greatly in need of donated items and financial assistance at this time. Helping Hands Food Pantry also is a great resource, and they have seen a good uptick in people. They have opened their doors within the last week, and you may have seen that in the Plainsman as well. They're located at 403 Dakota Avenue North. They're open Tuesday, Thursday, and Saturday from 12 o'clock p.m. to 4 o'clock p.m. It is a food pantry, and they do also have essential items. And you are able to pick up boxes from them once per month. You'll just be asked basic household information just so they can do a little bit of tracking there. They do also accept monetary donations. Gift cards from local grocery stores are accepted, non-perishable items. In addition to that, both Helping Hands and Salvation Army have thrift stores. And by purchasing in those thrift stores, that's what helps to fund their organizations as well. Huron also is very lucky to be part of a food giveaway program brought to Huron through Feeding South Dakota. Huron Church of the Open Bible and the Ministerial Association are really the key components in bringing that to Huron. The food giveaway is held currently at the South Dakota State Fairgrounds. They just held a food giveaway yesterday. They were planning on 400 to 450 meals that they gave away. And I wasn't able to contact them today yet to see how many they actually did, but that was over double what they had done in the past, which amounts to about 60 pounds of food per person is what they were planning on. 2 trucks coming into town versus 1. The next one is anticipated to come June 4th, I believe, and they come every 6 weeks. They just ask basic information, no qualification, just your name and household number. They want to know how many they're feeding, so they do ask for that. A lot of you may know that we have, through the school district, their grab and go bag lunches. You can pick up lunches Monday through Thursday from 11:45 to 12:15. And those are for children 0 to 18. You drive through coming in on 18th and Arizona. You enter on Arizona, exit on 18th Street, and each bag has 3 days of lunches in them. And you just tell them how many you need. So you're not your child going in, you go in and pick them up if needed. Drive through. Everything is COVID safe as they're doing things, but that is a great program that they will continue to be hosting. If you're unable to get your items, you have the money to buy them, but you can't get out, People's Transit will pick up your groceries for you and deliver them to you. You just need to tell them when they're available to be picked up. They will do that from 8 a.m. to 3:30 p.m. Monday through Friday. They do have a minimal cost of $250 to do that. You would call People's Transit at 353-0100 to prepay your delivery fee and let them know when those groceries are ready for pickup. So that's pretty convenient for those who aren't able to get out and get their own groceries. You call ahead and you order it. It is amazing how many our grocery stores are telling us that they serve through their delivery programs or ordering online, and you drive up and pick up it. And what a change to their way they do business. So everybody has really stepped up in this time, and that is awesome to know. If for some reason you can't, when you call 211, they'll give you this information. We're going to have it posted on our website too. There will be a link out shortly. But if you're unable to get the assistance that you think you need, 211 hasn't really met what you think you need, you can call the chamber at 352-0000, and we will try and make sure we can figure out how to get you what you need. There are some essential items that may not be part of the programs, and if there's something that you need and we can work that out, we will help you with that. We have a fund set up for essential item type of things that people may need, and if you wanted to donate there via credit card or a check, we're at 1725 Dakota Avenue South, or you can call and give us that information and we can take that donation from you. We, as far as our doors, are closed, but we are still open to the public and to our businesses to help. We are reaching out to our businesses on a regular basis. We are still doing all of the things that we did before. So we want you to know that our entryway door, actually the beginning door, is open. So if you need to drop off things to us, you can do that. We have a box in there available, and we have a mailbox in there as well. We have one person in the office every day, but we are practicing that social distancing too and trying to keep each of us safe because we know it's important to do what we do as well. As I mentioned, we will have a link on our website, the www.huronsd.com. And I know I have probably talked really fast, so I apologize for that. But there's so many good things that our community is stepping up and doing, and I would encourage you to check the Huron to Go page to see what is out there. We will be posting things out there regularly. And one of the other things that we are doing at the chamber is also beginning Monday, we are doing a Huron gift card and give campaign. So be on the lookout for that. If you purchase a gift card or a gift certificate from any Huron business, and you email that or text your receipt to us at cvb@huronsd.com, you'll be entered into a chance to win $25 in Huron bucks. And then you can also name somebody that you want to give another $25 in Huron bucks. So a pay it forward type of campaign, gift card and giveaway. So hopefully we are trying to spur you to purchase locally whenever possible. I know that our survey results had said that a lot of people are using online shopping these days, and that is understandable. But no, now more than ever, our Huron businesses really do need you to support them in any way that you can. So you'll see more information about our Huron gift card and give campaign, and I encourage you to take part in that and help somebody else too by paying it forward. So thank you, Mark, for your time. And if anybody has questions, please give us a call at the chamber. We are available pretty much all the time. So thank you very much.
Okay. Thank you, Lori. And that goes back to everybody here. I know we're in these challenging times. We're in this together, but everybody's still open. You can make contact with HRMC. Somebody's always going to be there. Same at City Hall. Somebody's always going to be there. We're always going to answer the phones. All of our local businesses, they're open. They're doing to-go orders and everything else. We need to get out and make sure that we're supporting all of them. Before we go into questions, anybody else have anything? No? Everybody's all quiet and ready. All right, I do have a couple questions that came in. Some of them are in relation to what we talked about, or I talked about earlier, as far as when can some of the restrictions be lifted and so forth. We kind of covered some of that with Dr. Redden, but that's something the city leaders are going to have to work on and come up with a plan and try to mitigate the risk that's still there with COVID-19. So they are working on that. That is a plan that they're working on with the task force and making sure they follow all the guidance that is out there. Let me page through some of these here. I do have a question about the Abbott COVID-19 testing machine. It is good that the Huron community has this new capability. I have read where there are shortages in supplies to operate this sort of equipment. However, does HRMC actually have supplies available to process samples? And if so, how many samples can actually be tested? And what is the time frame associated with obtaining or replenishing the supplies?
So we do have plenty of supplies on hand. The exact number changes daily, so I can't give an exact number. We do get our supplies directly from the state, and the state has an allocation with the federal government. We haven't heard when they're releasing any more, but as of right now, we are covered in supplies.
Okay. Thank you. And that is all I have for questions. Otherwise, they relate back to what we talked about the restrictions that are in place. So I'd like to thank our panel that came in to the room today, and also Lori Shelton, David McGurr for coming or speaking to us through Zoom. It's definitely some challenging times, and communicating with each other over technology and which camera to look at and so forth, it makes it interesting. But we're in this together. Like I said, the Beetle County Task Force is working on a plan of how to implement maybe some changes to ordinances and provide some guidance to their elected leaders. But as we talked about today, that concern for community spread is still there, and Sioux Falls is only a short amount of miles away. So that is all we have today. I thank you for everybody that tuned in and my panel. Have a great Friday.